You're watching ABC4 News.
With the vaccine continuing to roll out, women who are pregnant and or breastfeeding may have questions around its safety. Joining us today is registered nurse Al Romeo. He's also a counselor with the Utah Department of Health. Al works to prevent birth defects and developmental delays and helps parents with the care they need. Thank you so much, Al, for joining us here today.
Thank you for having me out today.
So we have a handful of questions. First off, hundreds of thousands of COVID-19 vaccines have already been given to people throughout the state, such as healthcare workers and teachers, women who work in these kinds of jobs, higher risk, pregnant women are at a higher risk. So women that are pregnant and or breastfeeding, is it safe for them to get the COVID-19 vaccine?
So yeah, there's a few things that women that are pregnant and breastfeeding need to consider. First thing we want to look at is the disease itself. We always want to look at the different risks and benefits. So the disease itself, we all are very familiar with COVID-19, and of course people can die from it. In pregnancy, we do see an increased risk of preterm labor and breathing difficulties. We don't want mom to end up on a ventilator, compromising her and baby's oxygen. So we do know that disease itself can be a problem for pregnancy, but we'll look at, the COVID-19 vaccine and the other vaccines as we talk today.
You know, Al, I was pregnant at the beginning of all of this, the breakout of COVID-19, and it was so alarming for me because there were so many unanswered questions. There are a lot of nerves being pregnant in this time. And one thing we want to point out, though, these are not live vaccines, right? So is the fact that the vaccine isn't live a good thing for pregnant women or women breastfeeding?
Yes, absolutely. That's one of the things we wanted to talk about today is we have lots of research on those vaccines that are not live vaccine. And the COVID-19 vaccines, the mRNA vaccines, they are not live vaccines. So we don't see any increased risk of birth defects or other problems in the pregnancy from those types of not live vaccines. For example, you're probably familiar with the Tdap vaccine. So you probably had that in the third trimester of every pregnancy. And that Tdap vaccine protects baby from whooping cough or pertussis. And yes, it's very well studied in pregnancy and breastfeeding, no increased risk. Now, there's another vaccine that pregnant and breastfeeding women are already getting. We have lots of good research on this one also, is the flu vaccine. So again, no increased risk of problems for that one either. So yeah, we have good experience with other vaccines, and we'll talk a little bit about the COVID-19 vaccine in particular.
Can you tell me too, is there an issue with misinformation, or is there a reason for women to feel the nerves? Obviously you have calmed a lot of that with the questions here, or answers to the questions here today, but what do you want pregnant women now to know, and also those breastfeeding?
Absolutely. So at Mother to Baby, we are getting this question very frequently. It's our most common question in December and January. So yes, a lot of women are concerned. Of course, they need to talk to their providers about their specific situation. They'll know their medical history and what else is going on. But for this vaccine, the COVID-19 vaccine, women were excluded, pregnant and breastfeeding women were excluded from those early research studies, but the new research studies are starting up soon. We'll be referring women to those, and we'll be looking at those research results to provide us a little bit more information. But what we know about the vaccines so far is those mRNA vaccines, they degrade very quickly when they're in the body, so not likely to be a problem for pregnancy. And for breastfeeding, even if a little bit of those particles get into the milk, baby's stomach acid will destroy it. So not likely to get to baby. So not likely to be a problem for pregnancy or breastfeeding, but we're going to look at the research as we get more and look for women to enroll in those research studies.
Always comforting to get more and more information. Thank you so much for your time today. If people have questions, you can head to coronavirus.utah.gov/vaccine. Again, thank you for your time today, Al. We appreciate it.
Thank you.